Hey everyone, and welcome to Recharge the Podcast. I'm David Coe. My guest today is a healthcare executive, advisor, author, activist, and friend. His leadership has helped to build some of the most successful companies in the industry. As a pioneer in the field, he's made headlines for his business acumen, his advocacy for fair wages, and his personal mission to keep humanity in healthcare. Let's recharge with John Driscoll. Hi, John. How are you? Thank you for being here today.
Oh, great, David. I'm just delighted to be here with an old friend.
I can't tell you how excited I am for today's conversation. I've been really looking forward to this because I know how much you are juggling and you continue to juggle, whether it's, your projects on the board of University of Connecticut, Waystar, Magnet Health, and others, and your own podcast, which I was so lucky to be on, Care Talk. So I know how busy you are. But I always like to start my podcast, as many of our listeners know, by doing a quick pulse check. And that pulse check is this whole podcast of mine was inspired by my book, Recharge, which is to really think about your mental health like a phone battery. And so, if we're going to do a quick check in with you, my first question is, how's your battery and why?
I'm kind of fired up, David. I'm working on some really interesting projects. We're doing some really cool things with the state of Connecticut and with the UConn Health system. It's the end of the week, so and I'm traveling a little bit, so I'm a little weary, but I got a great night's sleep last night and worked out first thing this morning, and I've got a couple of more. It's late in the day on the East Coast on Friday, and I'm charged up about this conversation and about a few of the other things we're going to try to accomplish. I'm blessed. I get to work on things that I think matter with people that I learned from and that are also interested in kind of service and purpose. And I'm also blessed with a great family and a network of friends that help me recharge and remind me of why purpose is so much a part of the center of what I try to do.
You just hit on a bunch of things that we're going to talk about throughout the hour as we kind of dig into your impressive career and all the knowledge that you have around healthcare. I wanted to just talk a little bit about the personal connection you have to the field. And that is, you've spoken about this, about your mother, and you've spoken about how, she, as a nurse, you've got to really understand and have a really idealistic view of what nurses actually do. And then you also tragically lost a sibling that you've talked about at a very young age to cystic fibrosis. How did those experiences shape your view of healthcare?
I think I was really lucky that my mom trained as a nurse and was very proud to be a nurse. And David, at 92 years old, she still refers to herself as a nurse. And so, and so my first introduction to a healthcare professional was someone who was really heart-centered and
Mhm.
sort of thought about caregiving, before clinical. And so for me, that sort of gave me a bit of a North Star in terms of how I thought about the right kind of care in healthcare. For my sister died when I was young, and she barely she died in the first year of life.
Mhm.
Um, but when you see someone who you dearly love struggling to breathe in a tent, and everyone's just trying to keep her alive, you realize, even when you're a young person, the privilege of life and how fragile it is. And I think that the thing about cystic fibrosis is not just the burden of losing a sister, which was, a deep wound in my family, but just this sense of the fragility of life brought into, in acute focus when, electricity goes out and firemen have to come to keep the tent going that's
Mhm.
keeping your sister breathing. But also watching how a generation later, my cousin's son, who has cystic fibrosis,
Mhm.
has every possibility to live into a bright adulthood. And the beyond the wound, the fascinating thing about cystic fibrosis, having watched the investment of biotechnology and caregivers and new therapies, the transformational aspect of Western medicine at its best. And so I
Mhm.
suppose I take from my mother this notion that the heart's got to be at the center of caregiving, and from my sister just the how important what we do at any level in healthcare, whether you're helping clean bedpans or cure cancer, is to the essence of life, and then the possibility that really transformational things can happen even within a generation. Transformational things for a disease that was a death sentence for every child that had it up until the relatively recent history, and now is a manageable disease in many
Mm.
ways.
Well, thank you for sharing that, John. So much of what you said there seems to have also shaped you're really thinking around whole person care. Very early on in your career, whether you were at Oxford Health as an SVP, and you really saw some of the challenges around Medicare and the system of Medicare and Medicaid, and in coordinating care for patients in need. And I was struck by how early you actually were really talking about whole patient care. For our listeners and audience here who are watching in, can you first kind of help us understand the definition of whole patient care, and then really talk to us about what you saw back then about why you felt it was so important?
Well, first of all, David, I think the glib way is that for too many people, their healthcare mission, they're part of the healthcare system is as a billing event. And
Right.
for too many of us, we are a transaction that the healthcare system needs to process and only sometimes pay for. And the the interaction with the healthcare system is very transactional. You've got a problem, you go to the ER, it gets fixed. You have a heart attack, something happens. But our health is actually related to so many other things.
Mm.
And I think that for me, when I had the privilege of being very early involved very early on in some of the earlier Medicare, care for the elderly, Medicaid,
Mm.
care for the poor, managed care programs in New York Metro, it was just so very clear to me that um, things like food insecurity and connection to the community, social connections for lonely elderly people were directly related to healthcare
Mm.
vulnerability. That um, for poor mothers on Medicaid, that simply access to predictable transport to the OB was
Mm.
as much a problem as their non-compliance
Yeah. Right.
with whatever care regime was there. And so the the in many ways the solution to avoiding an epic bad event or changing the arc of chronic disease had much more to do with making sure people had food on the table and transportation and access to the care that they needed.
Mm.
That if you wanted to solve the healthcare problem, you had to step back and look
Right.
at the person's life in context. I mean, a classic example, David, is that a lot of solutions in the classroom or the boardroom for solving the problems of the poor don't build into the notion that a lot of poor people are working more than one job. They're actually
Mm.
extremely busy.
Yeah.
A mother on Medicaid may have a couple of kids and a complicated situation with his or her landlord and is trying to juggle a bunch of things. And so the solution isn't solutions that the healthcare system says, well, you can need an appointment in the middle of the day, 2 weeks from now. That is between 9 and 5, isn't necessarily responsive to their needs. An elderly, aging, you know, immigrant from another part of the world who is surrounded by, has no social network and modest English may have a much harder time interacting, no matter how accessible the healthcare system is, because you're not dealing with the underlying issues of social isolation and morale
Mm.
um, that are directly related, again, to being able to get access to care, the care you need, and being attentive to the things you need to do to stay healthy. It was, if you spend what I did is I just spent time in neighborhoods and trying to shadow patients and members of the people we served. And it quickly becomes apparent that the healthcare system is really good at solving the problem in front of it. But to solve healthcare, we need to look at where the person sort of sits in the community and how their healthcare challenges fit or don't fit in their life.
I want to double click on something. You did spend time in those communities. You
Sure.
know, you did go and really try to understand what was happening. Too often, actually, I think so many of us, we kind of sit back, and I've heard this from others, and they let others do that on their behalf. You, as a very senior executive, actually went into those communities, saw what was happening, and that helped to inform and shape a lot of your thought process. And you talked about this very, very early before it even became, I would say, a mainstream discussion topic. If I'm correct there.
The good fortune I had, David, is, I had all kinds of weird jobs early on. One of the things I did is before I went to business school, I developed housing programs for homeless families, transitional programs for homeless families in Massachusetts. And we quickly found for the Department of Social Services after between college and graduate school is that there were more empty public health units than we had homeless families, and yet
Hmm.
homeless families were cycling through the system. I mean, there were a number of different kind of core reasons. Um, Pregnant and parenting teens were not taught how to run a household. Um, Battered women needed access to mental health and transitional health services and safety.
Hmm.
Um, People who had drug or alcohol addiction, opioid use addiction really wasn't as big then, but it was there, needed to get to have drug treatment integrated into their transition off of the streets. I didn't in a few years of working, I never met a family that wanted to live in a shelter or get stuck in a hotel or motel without a kitchen. But the underlying social problems, if you will, the underlying reasons they ended up losing their homes, battered women or whatever, weren't being addressed. And so unless you sort of stepped back and dealt with the whole person, and that sort of gave me a great lesson, and I immediately transitioned when I had the good fortune to start Medicare and Medicaid and really lead that at Oxford. Um, Gave me sort of, I guess it humbled me about what the healthcare system might not know and what I needed to learn.
Well, John, I want to take that and continue the conversation because you want to go back to 2013 and the time you became CEO of CareCentrix. And when you became CEO, it was struggling. And you kind of did something there that was, I would say, a bit unconventional. You froze the compensation for your executives, but you actually doubled the compensation for many entry level wage workers. What was your thinking behind that? And what gave you the conviction that it would work?
Well, I think you do a lot of stuff in business or life, David, where you just try to do the right thing. You hope not just that it will work, but you'll make it work. And this was one of those things where I just felt it was a moral imperative. I was fortunate enough to get that job in 2013, and within the first week, I realized we were about 70% off of the plan that the investors had. The stock had dropped by about 80%. And we were down to about $5 million in cash. I guess
Huh.
we were over half a billion in revenue, and that's just not much of a balance sheet, particularly when we had a lot of debt. But it was quite clear to me because I spend a lot of time, again, just talking to our frontline employees, that people who were picking up the phone, paying the claims, that they were struggling. I had the minimum wage at the time then, and it was at $7.25 an hour. That's 13 years ago. It still is that in 19 states, which is kind of ridiculous.
Hmm.
And I had one employee who asked for an advance on her salary. She was living in her car with her child and
Hmm.
was a very happy customer service rep, but was looking to get a security deposit. And another employee who explained that she had been burned out of her apartment. There was a fire had started, and that she just needed to borrow money and wanted to raise some money from the senior management to raise money for diapers for her child. Once you start to open the aperture to have conversations about where people are in their lives, people will share some very honest stuff, pretty tough stuff. And no one was looking to they weren't asking for a pay raise, Dave. They just were looking to find a way to gap themselves to the point where they can continue to work at CareCentrix. We had a very high turnover rate, and the our company at the time, like many, didn't put two and two together. Because we were in a difficult circumstance and weren't making much money, I thought it was super important that we invest the typical annual increase of the executives into those front lines. So we cut some corners and saved a bunch of money on executive compensation and relatively quickly doubled the minimum wage, entry level minimum wage at the company to $15 an hour. And I thought that was essential because that was got people close to or better than a living wage. And for Florida and for Connecticut, where we were had most of our employees, it was, I think, a necessary investment. I just don't believe you can starve people for success. I think there's a very, very high cost for low poverty wages that a lot of companies don't realize. And for me, I believe that it wasn't just paying more to our front line was important, but it was also important that the executives send the message to the company that we're in this together. And
That's
the
right.
most sincere way to do that was to freeze their own salaries, including mine. And we weren't just, again, going to be trying to, uh, you know, treat people, to try to get people as little as we could. We were going to invest in them so that they could have a job that would pay them a living wage. And I believed that at the time, if we invested in our team, in our people, and we invested in this broader notion of team and fairness, that it would really pay dividends in terms of company success.
Yeah.
And I was absolutely committed to make sure that we would be successful.
Yeah. Yeah. And look, the outcome, and you were, and we'll get to that in just a moment. But again, it was 2013.
We were pioneers at the time. Subsequent to that, you've seen at JP Morgan, Walmart being my favorite example, really move wages up. When I was at Walgreens, we briefly got Walgreens committed
Yeah.
to that as well. They seem to have fallen backwards, but we were very early on.
I want to ask you about the just employee response. So you go out and you do this. What was the employee response like throughout the company, if you can kind of take us back a little?
Yeah.
And what
Yeah,
results
I
did you end
you
up
know,
seeing?
the business results were the business over the next 9 years grew by 3 or 4x, and the value of the business grew by more than 4x, and we ended up selling it for, around $1 billion to Walgreens. Um, Honestly, it shakes me. Like some of the emails you got, it was transformational, David. When people
Yeah.
can pay for a roof over their head, they're doing a job they like, trying to do the best they can, often working one and a half or two jobs, not seeing their kids, to go from that to actually being able to afford to live on the wages for a job they liked. I mean, it brought tears to your eyes. I mean, some of the
Mm.
responses were were quite moving. I think first incredulity, like you're going to increase our wages for what? Like, no, just because it's the right thing to do. So, secondly, wow, I can actually focus on my job. To third, just deep appreciation of the fact that, and perhaps that, we live in a very cynical time, but maybe this is a company where we really are all in it together. And that was that sense of team and purpose and connection and alignment with, what we say when we say our employees are our most important asset. We have to invest in it, in our most important asset. But the human response was amazing, and we continue to do all kinds of things, like we put a ceiling on healthcare costs so that the out of pocket, even though inflation kept going up,
Mm.
was
Love
never
that.
unaffordable. We offered financial literacy training to all of
Mm.
our employees so that people could understand how to fix their credit scores, how to build a budget, how to kind of manage their household. We did, a number of things that helped people take advantage of the good wages for good jobs that we were creating. Because I think to some degree, like healthcare costs eat things up. People don't know how to manage, manage necessarily their affairs in a complicated financial environment. And yeah, no, it was it really built a deep, resilient sense of team, which really played out because we had to also navigate some pretty tough healthcare challenges over the next 9 years. At one point, we lost half of our revenue and had to actually cut executive salaries, substantially reduce headcount. In that moment, people actually they knew that we were totally transparent,
Mhm.
that we had done everything we possibly could, and many of those folks that we had to move out actually expressed a great deal of regret that they had to leave. And then when we doubled the size of the company again, many of them got hired back and
That's
were
great.
delighted to. When you invest in your team, it doesn't mean you sort of invest without a sense of return, um, but it does validate this notion of a team-based company, which
Mm.
allowed us to navigate some very, very difficult circumstances over time and allowed us to not just grow the company once, but grow it twice.
Well, there's so many elements here of when you talk that even go back to where we started this conversation around whole patient care. And when you really talk about the physical, the mental, but also, the financial components, family support, your environment, you were kind of creating this environment that made it so you could optimize and your employees could boost productivity while paying for, the daily kind of life by doubling their wages. So you were kind of, yeah, I see these pull through elements that you have from earlier in our conversation in terms of what you were doing when you were at CareCentrix.
I think it's all part of a philosophy of how you kind of live a life of purpose and try to not just live a good life yourself, but try to provide it for others. In the we also crowdsourced ideas on charity and social engagement in every community we played with, we hired in. And I thought that was really important because when people are a little bit more connected to their community and do a little bit of charity, they also form deep personal connections with each other. And that wasn't top down; it was really organic from the different departments and locations. And I just think if you've got that kind of team based whole person uh, respect for the individual, but an ambition for a team culture, um, more and more ideas come out of the woodwork, not just, by the way, from the executives, but many of them from the employees themselves. Because we'd poll them and we'd ask them, like, what do you need that we could help out with? Doesn't mean we're going to pay for everything, but maybe we can connect you to some resources. What would you like to do? I'd like to spend a little bit more time doing charitable stuff with folks from our team. I'm like, okay, well, we'll set up we'll make it easy for you to do that and set up those kind of connections. I think, the things that people really want out of life, Dave, you need to, the average employee wants to be paid fairly. They want to be doing something with a sense of mission and purpose. And we were very clear that our job was to make that last mile. We were in the post-acute care business, that last mile of care healthy, happy, and successful for patients. And they also want to have some notion of connection
That's right.
and respect.
Mhm.
And that we really focused on all of that and promoted, hired, promoted, and supported people at every level who had those values.
I love that. Hey, so thanks everyone for watching. Our conversation with John was so insightful that we just wanted to keep it going. So stay tuned for part two.